G'day, welcome to Emergency Medicine Topics in One Coffee. I'm Alan Giles, an emergency physician, and today we're going to look at lower back pain from an emergency department perspective. Specifically, we're going to look at the red flags that you should be aware of to enable your patient's safety, but also to keep yourself out of the Healthcare Complaints Commission. Now, there are 6 red flags we're going to identify. Red flag number 1, the elderly patient with acute onset lower back pain. Prove to yourself that it's not an expanding abdominal aortic aneurysm. Every one of these patients requires a bedside ultrasound. And let's face it, you shouldn't miss it, because if it's symptomatic, it's going to be 5 centimeters plus in diameter. If you do miss it, remember there's going to be a Grim Reaper inside that AAA. Red flag number 2, worsening lower back pain in a patient who's had a lumbar puncture or an epidural. Now, you've got to exclude a hematoma, an epidural hematoma, and this may require pushing to get an MRI from radiology, but it's worth doing. Red flag number 3. Now, this is normally missed because you haven't asked the patient about bowel and bladder symptoms. Because if they have those, you should be thinking that they might have a cauda equina syndrome, that is that the nerves that have come out after the end of the spinal cord are being compressed. I mean, they may be compressed from lots of different things. They may be compressed from trauma, they may be compressed from a large prolapsed disc, they may be compressed from metastases, from a whole group of things. Once you've suspected it, you need to make sure you do a good sensory and motor distal examination, including anal tone. And then how do you investigate it? Well, unsurprisingly, I'll say you should do an MRI. If you're unable to get that, it's not available to you, then a lumbar CT with a myelogram, lumbar myelogram is a reasonable option. Red flag number 4. It's a patient who has lower back pain but has a background of intravenous drug use or is immunocompromised. These patients have a high chance of having a collection of epidural pus. They need a good examination and investigation to exclude this. It seems every year the Ministry of Health puts out a circular warning of another case that has been either delayed diagnosis or a misdiagnosis of epidural pus that has had a bad outcome. So please be careful of this. Red flag number 5, a patient who represents with lower back pain. If this occurs, think image, think senior review, and think likely admission. It is very likely they will need to be admitted into hospital. Now, don't get sucked in to the, well, they're representing because they're a drug seeker. This still occurs in some EDs. Let's face it, if I wanted to get narcotics, would I go to a busy, noisy emergency department with a prolonged wait? I think I could find both a legal and illegal way of getting my narcotics, which is a hell of a lot easier. So don't get sucked into that. Representation, red flag number 5. Now finally, red flag number 6. Patients who present with lower back pain and have a history of malignancy, especially those malignancies that we know metastasize to bone, such as thyroid, breast, lung, bowel, multiple myeloma and prostate. Now, the imaging that's just probably best for this would be CT scan because it sees the bones so well. All I'm saying to you with these patients is be suspicious and chase them a little bit harder. Prove to yourself that they haven't got a med. Okay, well, I think that'll just about do for the 6 red flags you should watch for when investigating and seeing patients with lower back pain in the emergency department. Thanks for watching, and I'll see you all next time. Cheers.